Hi, I'm Dr. Stan Steindl. Welcome to Compassion in a T-shirt in session. Today we'll be speaking with Dr. Johannes Graser, who is a clinical psychologist, a CBT and CFT therapist, and researcher and lecturer. He's based at the Witten-Herdecke University in Germany. His research focuses on CFT with people who have developmental disabilities and also persistent depressive disorder. He likes to perform stand-up comedy with his humour and intellect about on par. I do hope you enjoy being in session with my friend Dr. Johannes Graser. Well, welcome, Johannes Graser.
Perfect.
Thank you. Yes, it's wonderful to get a chance to chat with you on Compassion in a T-shirt in session. Where are you at the moment?
I'm in Bochum, which is in the west of Germany, and that's where I live with my girlfriend. Oh, now I can say not with my fiance.
Oh,
2 weeks. Yes. Yeah, that's recent
congratulations.
news. Thank you.
Yes, you've heard it first on Compassion in a T-shirt.
Yeah.
Oh, that's
That's
lovely,
right.
lovely news.
Mm-hmm. And yeah, that's close to where she and I work.
Right.
She works in Düsseldorf at a university hospital, and I work in Witten at a university, which has an outpatient clinic as well where I work. Yeah.
Yeah, right. Yes, well, I was trying to think. We've caught up a couple of times face to face, I guess, in certainly Edinburgh and possibly, was it Manchester or Birmingham?
London and Manchester, I think.
London and Manchester. You weren't at Edinburgh last year?
Yes, I did.
2 years ago.
No, I was.
Yeah.
But the first time we met, I think, was in Manchester.
Yeah. Which is actually quite a few years now, isn't it? It's sort of time passes. And you were saying to me just prior to us hitting the record button that you spent a year in Darwin, in Australia.
Yeah, pretty much. Yeah, it was like 9 or 10 months. And there was I actually tried to do my community service in Australia, which is mandatory for Germans to either do a 10 months of military service or community service. And I tried to do that in Australia, but that didn't work. And so I did that in Germany first. But then I still felt, I want to see a bit more of the world before I go to university. I applied for this volunteering project in Darwin, which was a mixed school for both like Aboriginal boarding school and kids, and like kids from Darwin that lived there. And I was an assistant teacher, like for maths, for spelling, but the best subject was actually outdoor education, where the Aboriginal kids taught all the other guys like me about the nature. That was awesome.
Wow, what an incredible experience. And so much to learn there for you, but also that sort of generous spirit that you've got. I know we'll talk a bit later about maybe some other work that you're doing as well, but I wondered whether we could start just maybe kind of telling us a little bit about you and perhaps where you've kind of come from in your life. What's the Johannes Graser story?
Oh, that's a good question. So I actually, before that whole volunteering experience and community service experience, I didn't know yet where to go in my professional life. Like, I didn't feel prepared for that question after high school. So, but that community service time and the volunteering time helped me a lot to decide. The community service I spent in Stuttgart in a sheltered workshop for people with disabilities, and that was also very a great time, honestly. And that's where I've met the first psychologist I ever encountered. She worked at that place, and that's how my interest in psychology was sparked. And from then, and then I started studying psychology, and yeah, loved it. Wasn't yet sure to go into clinical psychology, but after my first clinical internship, I knew it that I want to do it. I loved it actually.
Mm.
And then fast forward a few years after finishing the studies, I started clinical training in Frankfurt, and then there was a workshop held by Chris Germer at a place where I did my therapy training, and that's how I first got in contact with compassion. And then said, "Oh, like compassion really hit me when I first did these first exercises with Chris." And yeah, then I said, "Oh yeah, I want to do a PhD on that." And that's how I got into the compassion space. First tried the mindful self-compassion training by Chris Germer with patients, but then I noticed what also Paul tells us all the time when he started developing CFT, that you get all these resistances with from the people and doing compassion exercises, and then I started reading into what Paul has to say, and that brought me to CFT.
Just going back to the very first bit that you said, because it's interesting for me, the way that we kind of don't know what on earth we want to do when we're finishing school.
Totally.
On the other hand, there was something there that made you aware that you wanted to go and do the community service kind of side, perhaps rather than the military side, I guess, or that sort of
Yeah, yeah.
thing. But so when you think back to that time, what was going through that young person's mind there, do you think?
Yeah, like it was like I definitely knew I don't want to go to the military. So
Right.
there was a starting point.
Yes.
Um, um,
Yeah.
and then you can choose like whatever kind of community service you want to do in Germany.
Mm.
You could like ride an ambulance car, or work in an elderly place. There's a lot of
Mm.
stuff to choose from, and I always felt like. And that often probably came from my mother. She always worked. She did work with. She was a social worker, and she also worked in her younger years. She worked with people with mental disabilities, and and we visited a few of these places once, and I always had a feeling, wow, and that's a great place to like to work, or to also to learn. Like I felt very young at 19 when I finished high school. Like
Mm.
I didn't feel ready to like to take on a like the more serious parts of life yet. But I thought, yeah, let's do that community service, and that made me that helped growing up a lot, I think, like or to mature a lot, and get a good understanding for what you want to do in life,
Mm.
because I didn't feel that certainty after school. Yeah,
Mm. Yeah, there was it was a little bit in your blood, in terms of your
yeah,
mum was a
totally. Yeah,
helper, and there was
yeah.
that kind of sense that you really felt that you would like to do something there to sort of be helpful, and kind of a
Totally. Yeah.
compassionate motivation was kind of
Hmm.
in there, and obviously to come all the way to Australia and do some more
Yeah,
was kind of that developed things even further, and it's sort of it's almost like by the time you met with Chris Germer or read the work of Paul Gilbert, that really that was putting kind of a name or a process or something to what you were already really sensing within yourself.
totally. And it was such a strong feeling when I did the first compassion exercise with Chris Germer, having my eyes closed, and I felt, oh wow, that's it.
Mm,
Yeah,
yeah,
yeah.
me too. I actually
How,
first experienced MSc with Chris Germer and Kristen Neff, and can really relate to what you're saying. That kind of just the kind of felt sense of emotion coming up and kindness being brought to it. It's powerful stuff.
Totally. Yeah.
And yet
Like,
also at the same time, the fears, blocks and resistances coming up, actually, that was part of it too, isn't it? You know, we notice our own as much as anyone else's.
yeah.
Mm.
Yeah, that part was like, I at first didn't have that part yet, felt feeling it for myself. That's what I first felt, that when I tried to do it with patients, like that there can be such strong resistance to
Yes.
it. That was so fascinating as well, like how differently it's resonates with people. Like other patients like felt, oh, that was great, but you know, some the more self-critical ones, wow, for them it was really hard, and they really even said, oh, I don't want to do this ever again. Like,
Ah,
yeah,
yes.
yeah.
Yeah. It can be scary stuff. Actually, before we get more into that, I wondered if you could tell us about your research work, though, your PhD, which I think was relative. Oh, it's a little while ago now that you completed
Yeah,
that. But yeah,
yeah,
what was the story of the PhD work?
yeah. That was I did a group program then for people with persistent depressive disorder, and doing it was a bit of a mixed study, with like the first 4 sessions of MBCT, then CFT, then 8 sessions of CFT, and a little bit of loving kindness meditation.
Mm-hmm.
Like, so there was still a bit of a mixture. Now I do full on CFT, but in the PhD, it was like a 12-week program for persistent depressive disorder, with these ingredients like MBCT, CFT, loving kindness.
Mm-hmm.
And oh yeah, and that was like first I thought, oh, let's do MSc with these people, but that we quickly came to the conclusion, oh no, we should definitely do more CFT to deal with the difficulties. And that was my first treatment study that I did. And I also did um, a narrative review on compassion and loving kindness meditation, which was the biggest success of my PhD because it was published in the Harvard Review of Psychiatry. So that was cool. And
Very cool.
yeah, yeah, definitely. And a further study was more focused on emotion regulation. That was these were the 3 studies of my PhD. But now I'm doing CFT with people with mild and moderate intellectual disabilities who have either like anxiety symptoms, depression, self-criticism, or shame as a starting point for the inclusion for the therapy. And that's also very rewarding. Like you of course Neil Clapton, and if I'm a lot in contact with him about it, and with Lizzie Goat. And Neil created a 6-week program. Lizzie did a 10-week program, and I extended it a bit to a 12-week program. And that's what I'm doing mainly now. Yeah. Then another thing we do is there's a diagnostic manual for intellectual disabilities, which applies the DSM-5 criteria to different levels of intellectual disabilities. Like if, for example, if you have like a depression and a severe mental disability, like intellectual disability, it might show differently than a moderate intellectual disability. And these criteria were established by an American research group, and we translate this whole manual into German at the moment. Also, the fear of compassion scales. No, not the fear of compassion. The compassionate engagement and action scales. I'm doing a validation study on them, having already over 1,000 clinical and non-clinical each population. So that's going to be published maybe next year, but that's what I'm doing at the moment as well. And yeah, some more stuff in the intellectual disability community, like getting more diagnostic instruments for the German market validated, like some further depression and anxiety scales. That's what these are my research projects at the moment. Yeah.
When you did your PhD with people with more persistent depressive
Yeah.
disorders,
Yeah.
what did you sort of find in a process of change sort of a way? Did you notice any particular aspects that sort of helped to predict, one way or another as people changed with CFT?
Yeah, I think like it was interesting because the 12 weeks of CFT, they surely like weren't like enough to fully go into remission after persistent depressive disorder. Like some of them, I remember the mean age, the mean duration of the depression that the people already had was 11 and a half years. So that was really a chronic disorder, like for them. And but for some of them, I still kept on seeing after the 12 weeks for individual sessions, like when the study was over. And my idea was, or my takeaway from this was, like, even the ones that didn't get so much better in the group, like a little seed was planted already then, like to become more kind towards themselves. And it was like it may have taken much longer, but there was some development, like still and all the time. And I still get some emails from some of the members who were there, and they say, yeah, it's still in progress. It's still a work in progress, becoming more self-compassionate. And interestingly, like some of the patients in the trial were also after the trial continuing therapy with other therapists, and they told me as well, like, oh wow, they already had a lot going, like in the process with the development of towards like the development of being more kind to oneself, being less self-critical, like it. And that was my take, that it's not possible to maybe change like such a severe disorder in 12 weeks, but you can definitely plant a seed, and that may continue to help with healing. There was also the result of the follow-up analysis. The follow-up analysis, like it was only 3 months after the trial, were even better than the post group analysis. Like from a medium effect size, it went to a large effect size, even though there was no more therapy around during that period. Yeah.
Yes, I always feel like we sort of learn about it and then we sort of practice it and then we more gradually embody it. It feels like there's those three
Totally
phases, and it sounds like in a way, that fits with what you found as well, that the 12-week group absolutely helped people to become more perhaps mind aware and more knowledgeable and perhaps develop some of the skills and so on. But the self-criticism's pretty ground in there, isn't it? And so it just takes time to practice it and then gradually embody it, maybe over time. But that seed planting, it's important stuff.
Yeah, totally. So that was great. That was a great experience doing that trial. Yeah, and also like it's similar now with people with intellectual disabilities. Um, I finished the first group maybe last year ago, and I still get like messages from one of the members, and I said, "Oh, I'm still practicing the perfect nurturer, and it helps me a lot." Like it's really more a marathon than a sprint, I would say. The whole process, yeah.
More a marathon than a sprint. It's such a sort of inspiring in a way, isn't it? Because it's hard and it's long, but it's hopeful.
Yeah. Yes, exactly.
So people with intellectual disability and depression is the
depression
sort of,
or anxiety,
or depression or anxiety. So yeah, what have you kind of or kind of Neil as well that you mentioned, but what sort of adaptations have you made, or what does CFT and that kind of group look like?
Mhm. It's we of course we try to make it much less abstract and much more tangible and applicable. And it's a very colorful manual. And you work a lot with like illustrations. For example, like one thing I find a great example, the soothing reading breathing. We do it like how do you call these little bubbles that you do with soap? Like
Mm.
like we do it with them to make it more tangible what slow breathing looks like. Then like the bubbles don't blast out, but it goes like very smoothly, like because that's an abstract concept for people with intellectual disabilities. Like try to breathe very slowly is that doesn't do the job yet. Yeah, that
Mm.
for people with mild disabilities it may, but with moderate disabilities it's it takes a lot more to think about how can we how can I teach this person to do it. Yeah, that's an example. Yeah, we do a lot with like flashcards and emojis, what to differentiate what's a compassionate thought or what's a self-critical thought, something like that. And it's you, of course you have to um, um, do more repetition maybe. Yeah.
Mm.
And but what's also great is like, for example, the 3 circles model, we also do that. um, and no, like my experience is people with mild disability, mild intellectual disabilities, they don't have much problem like with the whole material. And they sometimes in a group then to teach the people about it with who might have moderate intellectual disabilities and explain it in their own words, and that helps a lot. Like I think the group setting helps a lot. Right, yeah, of course, regarding shame, like shame of course gets um, smaller if you notice, oh, I'm not alone with with this problem. Or and the whole group cohesion thing helps a lot. Like I really love doing group therapies. Yeah, I have to say.
Yeah, so there's some tricks of the trade, so to speak, there in terms of how to communicate, I guess, this
Yeah,
stuff, and
yeah,
making sure that you communicate it in a way that is readily accessible for people, and
totally.
using
Yeah,
using pictures and imagery, using examples from their own lives or things they might
yeah,
actually do, and of course, yeah, just that gentle repetition, just kind of going through it, each time.
yeah, yeah,
In fact, I think some
yeah,
of that
yeah.
is really
Yeah, a lot
useful
of
for all of our work. Yeah.
definitely, and of course lots of practice and discussing how practicing work, discussing the difficulties that arise when practicing. That's a
Mm.
big part of every session. Yeah.
Mm. Would every session involve things like eyes closed exercises and imagery and those sorts of
Yeah.
elements of CFT? Yeah.
Yeah. Yeah.
Mm.
Yeah. Like every session definitely has soothing rhythm breathing,
Okay.
um, and then it goes forward like compassionate imagery, like the place of contentment, we call it, not a safe place because of this difficulty with linking the safeness to the threat system, or
Mm.
safety to the threat system. We call it a place of contentment.
Mm.
Yeah,
Mm.
that's the second exercise. Then one of the favorites probably is the imagining a compassionate companion.
Mm.
That's or which could also be an animal or a fictitious person,
Mm.
and that's what people really liked in the group so far. Yeah.
Mm. Yeah, so actually, there's a lot of the key elements of CFT that really are applicable here and work very well, and
Mhm.
maybe a little bit of effort goes into framing them up, but actually, it even the phrase "place of contentment," that's interesting. That's a contentment seems like a sort of a somewhat abstract concept in a way, but
Mm, yeah, in German, maybe the word is a little bit easier.
oh.
Platz der Zufriedenheit, but maybe not. um,
Yes.
yeah.
I must admit that in a lot of my clinical work too, I refer less to safe place imagery and more to kind of calm place imagery. I guess. guess,
Yeah,
for
that's
similar
great.
reason.
Oh yeah, that's also
Mm,
exactly. Yeah.
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 And so with this particular kind of work that you're doing, what are some of the kind of the challenges that arise there, or even stuff around the fears, blocks, and resistances with this group?
Yes, one of the difficulties like is with maybe with homework, like that's maybe easier with populations who have no intellectual disabilities. Like you always need to get and try to get in the support system as well. Like so the last 10 minutes of every session, I bring the, the support staff who brought the people in and repeat what we did and repeat or tell them what would be great to do during the next week, like for home regarding homework and you like that's one thing that you need the support system as well, because like like reading because they need help with reading. um, the problem with or problems with resistances, like I think the it's not so much verbally expressed, the often like the I have a resistance to that, but it's rather like, oh, it makes me uneasy, or it makes me want to smash something. And like that's how it shows. And then what we do, of course, is like normalize it. Yeah, say, oh yeah, that's very normal, that happens. And it's what you're doing is great, like keep on doing it, and like keep on always doing the soothing rhythm breathing first before you go into that stuff. But like I have to say, I feel there's less resistance in that particular group than in the persistent depression group.
Mm,
That was stronger in the depression in the persistent depressive disorder group. Yeah.
mm.
Yeah.
Yes, because in some ways the structures around these people, are actually helpful with that. The support staff, or perhaps
Yeah.
families or support workers, can
Yeah.
kind of be there and sort of, can help with homework and practice, and that's a beautiful
Yeah.
idea that they're brought in at the end, and they're completely, sort of
Yes,
up to
this is.
speed with what actually has happened that session. And
Mhm.
so
Yeah.
in some
Yeah.
ways I could imagine that would almost facilitate homework more so.
Yeah, yeah, definitely, definitely. We also have, like, for every session we have a two page handout, which explains what was the plan for each session, and the exercises are printed out for them as well. So yeah, they get their own manual for
Mm.
themselves. Yeah.
There is a real wraparound feeling with all of that, isn't there? In a way, we're sort of wrapping around these guys, and you guys as a
Yeah,
facilitator are really trying
yeah,
hard, and the support workers are in there and helping, and the participants themselves are kind of, supporting each other, and sort of,
totally. Yeah,
it's
yeah.
got the way you describe it, it's got a beautiful feel to it.
Oh, totally. Yeah, it's really, I'm not exaggerating. That's a favorite part of my work, like doing these
Yes.
groups.
Yeah.
Yeah.
Yeah. And the other thought that occurred to me when you were saying, the sort of the more non-verbal expression. I mean, as a facilitator, I
Hmm.
suppose you kind of, you're sort of observing all the time different behavioral dynamics and how things might be expressed, sort of non-verbally, I guess. They're not really going to say, I don't feel like I deserve compassion or something, that
Yes. No.
it's
No.
less
No.
likely to be
Yeah.
spoken like that. Whereas,
Yes.
with my clients, it certainly is. But with
Yeah.
this,
Yeah.
it's you guys are, I guess, yeah, really having to be quite aware observationally of what might be
That's
the
true. That's
signs.
true. Yeah. That's also a reason why we these groups are much smaller than like the persistent depressive groups. Like the maximum number for these intellectual disability groups for me is 6, and I learned like it's like 4 is the perfect number to do a group in with that population. And whereas in persistent depressive disorder we had groups up to 11, like that was fine, you know.
Mm. Yeah.
So yeah, you have like also during every exercise you have to like always check in, like how is it for you, as is it and you know, like I take a lot of time then to explore like how every exercise was for each and any one of them,
Mm.
um like to notice if, you know, like if there are problems, and maybe there's shame talking about the problems. Yeah.
Mm. It's almost that you have little moments of sort of individual interaction with each of them.
Totally.
Keeping the
Yeah.
group small
Totally.
means that you can
Yeah.
check in and. Mm.
We also did that in the persistent depressive disorder group, by the way, but with small, like that we were two therapists, and we always um, put three patients together then in a small group, and then we went around and talked about difficulties, because that was an experience there. People didn't want to talk in the whole group maybe very openly,
Mm.
and these small groups helped a lot to
Mm.
facilitate that. Yeah.
Yeah, actually,
Yeah.
that's a great tip. You know, even in larger groups, having two therapists or two facilitators means that you can
Yeah.
do an exercise and then break up into smaller
Yeah.
groups, and everyone
Yeah.
gets a chance to
Hmm.
talk a little bit about it. You've mentioned a couple of times working with shame in
Yeah.
the stuff you're doing at the moment. Yeah, what are your thoughts there with, I guess, people with the intellectual disabilities, that perhaps there's depression or anxiety, but also shame?
Hmm. Yeah, I think shame is often linked to, like, for them, like around the topics for, oh, I don't learn as well as other people. You know, like I'm I have difficulties with learning. That's often a topic for these people. Yeah, and there, and I think the group process itself already helps with self acceptance in that regard, because that whole topic about um, I'm not alone with this helps probably to reduce the shame in that regard, I think. Yeah, and also like Paul distinguishes between internal and external shame. There's also like experience of external shame for them often. You know, like
Mm,
that others didn't treat them well, and brought like or created a feeling of shame in them. And that's something that I often more do in individual sessions, of course, like that we go very deeply into that. But yeah, that it's definitely an issue. And Neil Clapton also wrote a systematic review on that, like regarding shame and intellectual abilities, and he really um, um, made clear that it's a contributing factor for the ongoing psychological distress in this population. So I think it's very important to look out for shame, and to trying to normalize the experience, and also develop, of course, compassion the for the emotions. Yeah.
we often, I don't know, forget or neglect the fact that people who may have those sort of developmental or intellectual disabilities still experience the self-conscious emotions, still
Oh, definitely.
are very, you know, they're aware of themselves,
Yeah.
and as you say, sometimes they're aware of those capacities, and then become yeah, very self-conscious, or even experience shame around learning,
Hmm.
or, you know, how they might be
Yeah.
seen
Yeah.
by others.
Yeah. Exactly. Like what I also try, but that's actually a part that's more difficult. The multiple selves exercise. You know,
Mm,
that's where you can address. I think shame can be addressed very well there.
mm,
Um, but that's all. You have to very much keep in mind that it might be very abstract again, and
mm,
maybe not all people with intellectual disabilities will have an easy time with that. Yeah.
mm. And I love what you said before, you know, that you know, all the time as a facilitator, you're kind of trying to normalize and also affirm people and encourage and support,
Yeah.
and kind of validate this experience. You know, that
Mhm.
those are some really important therapeutic relationship type processes happening all the time in session.
Yeah, definitely. Um, yeah, it's. I also think it's so important, to um, to have an eye for the non-verbal mood in the room. I actually learned it from the MBCT manual, to trying to be grounded before you go into a session, not always when going towards the going through the day before I have these group sessions, not having a lot of appointments straight before it, so that I'm grounded myself. And also what Paul says, like trying to talk a little slower, and trying to do to create a great mood and in the group. And that's also that probably also helps with shame, I guess. Yeah.
Yeah, that's some really good tips as well. Sort of grounding oneself, slowing oneself down, then helps to kind of, I don't know, maybe lead the way a little bit in terms of creating a mood in the group that is kind of going to facilitate all of this stuff, especially around the more tricky topics, the
Exactly.
shame and so on. So, what would you say have been some of your great successes, if you like, or triumphs even, especially with this group, because this is a very important area of work that you're doing there? What were some successes?
Yeah, even if you do before every group going through the diagnostics, we have to do an intelligence test, intelligence assessment, and even that can be very rewarding for if you if you're very validating during it. Then even that you can create the feeling for the person that, yeah, I'm not all bad with stuff like this. I'm quite good maybe with logical stuff, and even that was one of the things I didn't experience and didn't expect before doing work with intellectual disabilities, that even if with in the assessment you can also already boost the maybe self-esteem a little bit, if you, because some of them say, oh god, not another test, I was always bad at tests. But even there you can, I think, already be validating. And I had one guy, he was really good in the IQ test, and he was then even the whole staff was also, wow, that's a great result. And he was already by that so almost cured, no more depression. So that was cool. And but of course also after the group, like I told you about that one guy who still sent messages, that's so great. When I hear from him, hey, Mr. Graser, I'm still doing the compassionate companion, and it still helps me. That's the biggest success for me. Yeah.
It's so important, as you say. The whole thing really begins with the assessment, doesn't it? If we can conduct the assessment in a way that is respectful and validating and affirming, we actually, what you said was so poignant. We create the feeling for a person that I'm not that bad. I mean, it gives you sort of shivers a little bit to think about it. If a person can go away from that assessment experience and actually, start to kind of act, own that feeling, or maybe I'm not that bad. I mean, that's therapeutic in the greatest sense.
Yeah, that's I get that feedback a lot, that people really like the it's Reynolds Intelligence Assessment Scales. That's a test that they really like the tests, and then also the support staff tell me, oh man, he really liked that last session. That's that is if you do, I think that's where it already starts being compassionate.
Exactly. That was the other thing I sort of jotted down was, yes, you begin even then this kind of felt sense of probably safeness, self-efficacy, but also compassion as well. Just begins to sort of, well, that's the seed planting bit as well. So
Yeah.
what about in your personal life? I'm always curious to hear. I mean, what do you notice in terms of compassion or self-compassion, and how it's just found its way in there?
Oh, that's a good question. Like, I noticed that a lot um, when I got into like the whole compassion um, topic by through Chris Germer. I practice a lot of loving kindness meditation.
Mm,
I still do, and I think that had a strong effect for interpersonal relationships. Like there was one sentence that I really think is so powerful in the loving kindness meditation. It's like, um, where you do the loving kindness toward a person you have difficulties with, and where you where it says, um, the person you have difficulties with is on a difficult path in life, and on the difficult path they create um, sorrow or pain also for other people, and but then notice, then developing compassion for that, I think that's very transformative.
mm,
Like yeah, like I think the compassion, like loving kindness toward a person with who have difficulties with, that's a very um, like transformative um, exercise, I think. And I did that quite a bit, and I think that's where I really noticed that that helped me, like being kinder. I
mm,
think,
mm,
um, but also like I try to tell people about it, like about the exercises, and like like even just friends who tell me, I have difficulty sleeping, or like I'm aroused a lot. Then I always say, hey, don't worry, I have something great for you.
Yeah, actually, that's interesting that you do that, and it sort of, kind of, it sort of spreads, doesn't it? Sometimes, like we
Yeah,
we
yeah,
we we get these ideas, and that we sort of mention them to others, and then it just sort of, it kind of spreads. But no,
yeah, yeah,
I agree that the sort of the more general kind of sense of loving kindness or kindness,
yeah,
to oneself and to others, and even to those
mm,
who are causing us some problems.
yeah,
It is a transformative practice, and there's a lot in that, isn't there? There's obviously sort of acceptance and non-judgment, but almost forgiveness
yeah.
is in that
Yes,
little
totally.
line that you
Yeah,
mentioned.
yeah. I think, yeah, and I think that's the exercise where I noticed the strongest shift in
Mm,
in my behavior.
mm,
But like all the exercises, I do them for myself, and
mm,
I like soothing breathing. I do every day, and like getting some imagery in as well. I love that, and
mm.
also the stuff that Paul says. Like the even if it's just like compassion under the duvet, just in the morning saying, "Hi, Johannes, how are you?" in a
Yeah,
kind voice.
yeah,
I love that.
yeah.
Yeah,
Beautiful. Well, one of the things that I ask people is to see whether you would have three tips that you might sort of, three tips that you might offer others who are on their own compassionate journey, that sort of thing. So yeah, what might be three tips?
yeah. I would like what I would say is, it takes time, and don't think you must feel it all at the beginning. It's like even the loving kindness for people with difficulties. That's a very advanced exercise, I think.
Mm,
Don't start with that. Start with soothing and breathing. Yeah, that's what I always say. That's the very first basic thing I would always start with.
mm,
Um, and like I will also always have a um, focus on how can I integrate compassion into my daily life. Like And there were like the thing with compassion under the duvet. Maybe every morning you say something, or every night before you go to bed you do an exercise, like trying to bring some, like regularity of the practice into your daily life. That would be the second tip. And the third, I think, and maybe the third tip would be, don't be too self-critical about it. Like if like I noticed that myself, like when I like it felt so big when I was still like a PhD student, like, oh wow, am I doing it right? Like the whole, like, am I doing CFT right? Um, like having gaining that confidence about doing it, that took me quite a while. And I would say also to people, like if they're practicing, you don't have to feel like confident about it yet. That's part of the practice. If you feel like, oh, I'm not good I'm not good yet at the practices, I always get distracted, like that's part of the process, accepting that, like being kind in these moments, and not self-critical. Like that's probably the last advice. Yeah.
It takes time. Start with the
Yeah.
soothing rhythm breathing and kind of go from there. How to integrate compassion into daily life. And it's that regularity of practice.
Yeah.
And don't be too critical. Don't be too self-critical about it. It's hard. And 2 steps forward, 1 step back, and on you go.
Yeah.
Well, that's really great, Johannes. Thanks so much for being willing to chat to me today. If people were wanting to get in touch or sort of learn more about your work, how could they do that?
They through the university homepage. If they Google my name, they will find the university homepage, and they can get in contact with me over there, through there. My email is on there. That would be the easiest way.
Yeah. And I will actually include links to your papers as well, especially the Harvard Review. Everyone must have a look at that at least, I think.
Oh man, yeah. That's it. Yeah.
All right. Well, that'll be good. But yeah, mate, thank you very much for coming and chatting with me from all the way over there in Germany, and yeah, look forward to chatting with you again soon.
Oh man, yeah. Hopefully.
Okay.
Okay.
See you then.